Hello, everybody, and welcome to Climate and Cuisine. Our guest today is Dr. Michael Greger, and my name is Jane DeMarinis, and I'm the Executive Director of Climate Diet, a nonprofit headquartered in Bethesda, Maryland. So welcome, Dr. Greger. I'm so excited to have you here. I met you at the National North American Vegan Society 2 years ago, mesmerized by the important information that you're imparting to the US population and the world population. I know you've written 6 books. I have your most recent one, How Not to Die, and want to dig into that. But any opening remarks?
Just the good news that we have tremendous power over our health destiny and longevity, and that the vast majority of premature death and disability is preventable with a healthy enough plant-based diet and lifestyle.
That sounds like you might have said that once or twice before.
But I still stumbled, so I packed too many of these into one day, I'm afraid.
Well, I am eager to jump into your book, which I've been taking notes on. I've been a vegetarian with my husband for 18 years and then a vegan for about 3.5. So I'm just still amazed at how much I don't know. And your book has so much new information, but I wanted to ask you, how did you become a vegetarian, or when did you become a vegetarian or vegan?
Oh, well, all goes back to my grandmother. I was just a little kid when a doctor sent my grandma home in a wheelchair to die. She had end-stage heart disease, confined in a wheelchair, crushing chest pain, or so many bypass surgeries, basically run out of plumbing at some point. Confined in a wheelchair. Her life was over at age 65, basically sent home to die. But then she heard about this guy, Nathan Pritikin, one of our early lifestyle medicine pioneers. And what happened next is actually detailed in Pritikin's biography. Talks about Frances Greger, my grandmother. They wheeled her in and she walked out, though she was given a medical death sentence at age 65. Thanks to a healthy diet, was able to enjoy another 31 years on this planet until age
Oh my
96
gosh.
to continue to enjoy her 6 grandkids, including me. So that's why I went into medicine. That's why I practice lifestyle medicine, why I started the website nutritionfacts.org, why I wrote the book How Not to Die, why all the proceeds from all my books are donated directly to charity. I just want to do for everyone's family what Pritikin did for my family.
Wow, that is an amazing story. And thank you so much for sharing it. And I did want to mention your website, and we should try to put that up on the screen at the end when we add information. You have, I think, 2,000 videos on that website. So it's an amazing resource for people that haven't yet found it. And so thank you for all that you're doing to try to educate the population.
And
Um,
it's free, nonprofit, science-based public service, daily updates on the latest in nutrition research via bite-sized videos. No ads, no corporate sponsorship, strictly non-commercial, not selling anything, just put it up as a public service, as a labor of love, as a tribute to my grandmother.
it's amazing. And thank you for such an altruistic approach to helping to educate this population. But we're only vegans, or only actually vegetarian and vegans together are only about 8% of our population. And we're actually the biggest meat eating country in the world, tied with Australia, according to the data that I've seen most recently. That's per capita. So, how do we get from the 8% to something a little better? Europe is way ahead of us. I'm sure you know they have Amsterdam, I think, has 30% of that city's population are vegan, with a goal of, I think, getting to 50% by 2000. I think it's 50. But anyway, Europe has less land, I guess, than the US, so they can't raise cattle as much as we can here. I think that's probably part of it. But what do you think we can do more than we're already doing? Because you're obviously doing a huge amount with videos every day on nutrition.
Well, I mean, it should come as no surprise that my answer is more education. Empowering people with this knowledge to save their own lives and the health and lives of their families. I think people want to take care of themselves, but they've just been bombarded by conflicting messages that often have some kind of, corporate conflict of interest. And so people are just left confused, throwing their hands up in the air, which is exactly what these food companies want. Just, they want people to, just give up and eat whatever's crap put in front of them. And so they muddy these waters by paying, to do these experiments with predetermined outcomes. And, to kind of confuse the situation, very similar to the tobacco industry. In fact, they're using the same kind of tobacco industry, playbook strategies to confuse the public. But the truth is, there's been this really remarkable consensus going about back decades about the core elements of healthy eating and living. In fact, you can go to truehealthinitiative.org. This was started by the head of Yale's Prevention Research Center, Dr. David Katz, who realized that people were confused about nutrition in a similar way that people are confused about climate change. And the reason people are confused about climate change is because there are very powerful industries that want people to remain confused about climate change. And so that's what the IPCC is for, is to bring together the top climate scientists in the world to agree on a consensus statement as to what's happening to our climate. Well, so that's what Dr. Katz did. It's like, okay, well, why don't we do the same thing for nutrition? Bring together hundreds of the top nutrition scientists from around the world to agree to a consensus statement as what is the healthiest human diet. Spoiler alert, it is a diet centered around whole plant foods.
And you're probably familiar with the plant-based treaty. I think 3 cities in the United States have signed it. So again, we're behind, but it was started, I think, in the UK, or I'm not sure if it came out of the UN conference, the climate conference of the UN in Dubai this year. I know it's new, but we're definitely not in first place in signing that by a long shot. Do you see that as also another way to drop some attention, to the...
Oh, it's really about drawing attention, right? I mean, it doesn't, proclamations are only important as so far as they influence actions that people take that have real world consequences. And so if people can, if an initiative like that gets people to say, wait a second, what I eat has an impact on the environment, or what I eat has an impact on my health, or, and to dig a little deeper, then, that kind of, I can see that kind of campaign being worthwhile.
And there's the other thing besides the huge toll, the cost to human health and the pain and suffering that comes with it. There's the cost to the taxpayer for the heart ailments, for the cancer, for the high blood pressure, all the treatments, the sadness that people miss out probably on so many activities due to these particular ailments. But the taxpayer is picking up the tab, certainly on Medicare and Medicaid, for a lot of these ailments. I don't know. It's never been, maybe that's a selfish way to look at it, but we all are paying taxes, so it's distributed across the country. But I don't know if you have any comment on that, but I do want to dig into your book because I have so many questions. I've got my cinnamon here and put it on my oatmeal this morning.
Nice.
I got my hibiscus berry tea, and I haven't actually started drinking it, but yeah, your book just has so much.
It doesn't work if you don't do it.
Well, I'm eager to do it.
All right, good.
The cinnamon I love, but
good.
So do you want to talk about some of those wonderful things? I'm trying to remember what Italian seasoning. I don't think it was marjoram, but has so many benefits to your body.
Marjarame's good. Oregano. They're both good. Spice things up in your life.
Well, can you talk about the actual impact on your system from that? I don't know if it's a vitamin increase. I read a lot of this a few days ago, and so it's in my notes someplace what the impact is, but I don't remember it.
Oh yeah, no, I don't remember the marjoram. Was that maybe it was in the oxidation chapter? All right, I can pull up my own book. We can figure it out.
Spices. It's in the spice. Yeah, that might be the oxidation chapter. I don't know. Yeah, I have to say, I don't always read a book from the beginning to the end. I usually start sort of where I find interesting, uh, photographs or interesting cutouts.
Uh-huh.
But I think it may have been actually oregano and the benefits it provides to your body. And I don't know if these are vitamins or antioxidants,
All
but
right, fine oregano. All right, I'm searching for it. Okay, well, so this is um two, two, two. Okay, well, so I mentioned oregano in the inflammation chapter, but it actually didn't help. Uh um but let's keep looking.
okay. Well, maybe I know curcumin is in there, and I had a question about that because I know that's in turmeric, but
Yep.
is the just cumin I use a lot in Southwest dishes? Is that part of curcumin, a short name of curcumin?
Nope. Completely
Oh,
different
okay.
substance. Completely different
Okay.
plant. Yeah, yeah, curcumin is the yellow pigment that gives turmeric and hence curry
Okay.
powder its distinctive yellow color. So it's a pigment compound. Cumin is a whole nother bush. But cumin has beneficial effects as well. I talk about it in my weight loss book, How Not to Diet. Um, and yeah, and yeah, no, but I do talk a lot about turmeric in uh in How Not to Die and How Not to Age.
I found all of that in the herbs that are so beneficial and have this huge impact. But then you also have like the daily dozen. Could you talk a little bit about that and how you even, vegetarians aren't necessarily, and I'm including myself in this, vegan, uh, maybe not always getting enough protein. I try to follow that. But anyway, the daily dozen is sort of a way to condition yourself and organize your own meals to make sure you're always hitting what you need. Am I right?
Yeah, so that came out of How Not to Die, where the first half of the book is 15 chapters, and each of the 15 leading causes of death. Talk about the role diet may play in preventing, arresting, or reversing each of our top 15 killers. We didn't want it to just be a reference book, so that's the second half, where I wanted to be kind of a practical day-to-day grocery store style guide. And so I sent my recommendations around the daily dozen checklist of all the healthiest of healthy things I encourage people to fit into their daily routine. So not just vegetables every day, but specifically dark green cruciferous vegetables, not just fruits every day, but specifically berries, the healthiest fruits. Legumes every day, beans, split peas, chickpeas, or lentils, tablespoon of ground flaxseed, quarter teaspoon of turmeric, the best beverages, how much exercise to get. Again, just trying to inspire people to include some of these healthiest things into their routine. It's available free as an app on iPhone, Android, Dr. Greger's Daily Dozen. And that doesn't have anything to do with protein. Now, protein, I mean, as I talk about in the new book, when it comes to protein, aging less may actually be more. Reducing protein intake, meaning restricting protein intake down to recommended levels, actually the only thing I could find that could help block all 11 of the aging pathways, boosting NAD, improving immunity, decreasing oxidative stress, inflammation, insulin resistance, as well as the cancer-promoting growth hormone IGF-1. Surprisingly, there is no benefit to adding extra protein to the diets of older men and women in terms of muscle mass, muscle strength, or muscle quality, or physical performance. Instead, the excess protein most Americans get causes a drop in the pro-longevity hormone FGF21, a drop in testosterone, a worsening of the age-accelerating enzyme mTOR. So we should strive to the recommended level of 0.8 grams per healthy kilogram body weight, which comes out to be about 45 grams a day for the average height woman, 55 a day for the average height man.
Well, that's an important, I haven't gone and read that section, but sort of in the main vein of, the great foods we can eat. And you mentioned the protein ones, legumes, beans, People talk a lot, and people say to me, no, I'm vegan, and they're not. And I don't try to promote it unless it seems like a logical way to take the conversation. But they talk about how expensive it is to be vegans,
Dried
which
beans? Dried beans
no,
are
but
the
of course
cheapest
it's
source of
just,
protein on the planet.
I know, of course it's just not true. So I don't know if you want to talk about
Yeah, no,
that.
so I mean, there's studies that actually just find out. So healthier diets, more plant-based diets are about 25 to 30% cheaper, save a family for about $500 a month, not a month, a year, switching to a strictly plant-based diet. I mean, think about some of the most expensive items in the grocery store. It's not, cabbage and apples and, and dried beans. It's, stuff in the, it's salmon or, some of this fancy junk food.
Yeah, I think lentils are like $1.50 a bag. It might not,
It's
they might be
ridiculous. It's ridiculous.
lentils. Yeah, well, people, I think, people think the alternative meats that have been made from plants, they are a little more expensive. But when you think about the cost in healthcare, which we already mentioned, uh, and the cost to the climate from cattle taking over so much of the land, and how much water they drink and how much food they eat, and so much food being raised just to feed cattle, cut out the middleman and just feed that food directly, those plants, to humans. Maybe not exactly the same food, but
Well, I mean, most of the same food, all right? It's, corn and soybeans. We could eat corn, we could eat beans.
yeah, absolutely. Um, well, what do you think is on the horizon for vegetarians and vegans? Do you see, you've been vegan a lot longer than I have, so you've seen increases. But what do you think is on the younger generation? I have three daughters, two are vegans, so I do see definitely more interest and awareness among young people. So I see that as an upward, climbing chart.
Well, you'd like to think so, although people have been excited about the youthful enthusiasm for healthier eating for decades, and they seem to grow out of it. Kids start out all idealistic, right? Wanting to, like, I don't know, go volunteer at a homeless shelter or want to make the better place a better, but then they're like, I'm gonna go on the stock market and buy BMW.
Well, I hope that's not true. Both of my daughters, we became vegan. My daughter bought us a book. It wasn't one of yours, but the China study, and my
Oh,
husband and
great.
I became vegan, vegetarian immediately, and then vegan later on. Um, but my kids are both the two that were vegans are still vegans, and they've been
Great.
vegan quite a while. So I
Good
had, of course,
parenting. That's the secret, I guess.
yes, I don't know. But there's so many benefits to it. So once you are one, it's such an easy way to maintain your weight. I think, for anybody, but maybe particularly for women that may be on diets more frequently than men. I don't know if there's any data to support that. It's
That
just
is
my
very
own.
true.
Um, you're looking at your waistline, and then if you eat vegan, you know, it's just so easy to keep your weight, maintain your weight, and feel good too.
Yeah, the
Anyway,
largest study of vegans in history, the Adventus 2 study, found that vegans on average about 35 pounds lighter than kind of average. Um, and that's not average general population, but average Adventists who tend to be really quite healthy and exercise a lot and eat more fruits and vegetables, etc. So, yeah, there does appear to be a big advantage in terms of weight control.
so here's a question for you. For those people out there that we haven't convinced to be vegans, what do you think, or vegetarians, what do you think is a good way to get people started down this path? Um,
Well, I
pull
mean, I'd like to think that, altruistic urges to save the planet or, that kind of thing would inspire people. And for certain young people, that may be the case. But it may just come down to, selfish, self-interest of wanting to live a long, healthy life and wanting to see their kids grow up and want to, be active and be able to do the things they want to do in life. And so to do that, you need a healthy diet. According to the Global Burden of Disease Study, the largest study of disease risk factors in history, the number one cause of death in these United States is the American diet, also a leading cause of disability. So it's like the most important decision we make in terms of our health and longevity. And so, if they don't care about anything else, hopefully they care about their own family's health.
So more specifically, to get people to take the first step, my organization recommends, we have a meat down pledge, just stop eating meat one day a week.
Oh, great. It's like a meatless Mondays kind of thing.
Right, exactly.
Sounds good. I'm all in favor.
It just seems like, well, if you can do it one day, maybe you'll see some impact and see that you don't miss it so much. And there's plenty of stuff to eat without eating meat. And maybe they'll start reading some information. I think definitely there's more information out there for us. Well, the Washington Post, one of the things my organization does is reach out to the media. And we have I know you're in the Washington area, our food editor is, I don't know if he's vegan or vegetarian, but he has recipes that are vegan and vegetarian every single week in that food section. So It's a great service and a great way to spread the word. So we're a little bit lucky on that, I think. So do you have any final thoughts? Anything you'd like to share with our audience? You've shared enough, I think. I'm going to hold your book up. This is
happy to. There's going to be a 10-year anniversary edition of the How Not to Die, published next year. So I'm going to be updating that in the near future. So that's exciting. My next book will be How Not to Hurt, talking about lifestyle approaches to pain management. Excited about that too. Oh, I'm going to have an Ozempic webinar coming up in a few months. That'll be exciting. Been working on that. So yeah, lots of good stuff coming up.
Well, Dr. Greger, it's just such a pleasure to have you here for our podcast. I hope you'll come back sometime. Thank you for the tremendous work that you do to help people get healthier and to become plant-based and do it for their own health, but also for the climate.
Happy to help. See you at next year's Summerfest.
Okay, take care. Thank you.